Hey everyone, Caitlin Moore here, and I need you to pay very close attention to what I'm about to reveal, because federal law enforcement is currently conducting one of the largest criminal investigations in American government history. And the target isn't some drug cartel or terrorist organization. It's a state government, New York State. FBI agents are executing search warrants. Congressional committees are issuing subpoenas to the governor's office. Federal prosecutors are filing criminal charges. And whistleblowers are testifying under oath that New York State has been operating an illegal scheme involving $112 billion in federal healthcare money for over 20 years. Here's what federal auditors discovered that triggered this investigation. 3 million people are currently receiving Medicaid benefits who don't qualify based on income requirements. $2.6 billion paid to people who don't even live in New York anymore. Federal agents traced these individuals to Florida, Texas, and other countries, yet checks kept flowing. And one home care program became so corrupted that federal prosecutors now have evidence of over $1 billion in fraud involving fake patients, billing for dead people, and caregivers collecting $200,000 annually for services never provided. So hit that subscribe button for Caitlin Moore right now, because what I'm about to expose will show you exactly what federal investigators found, how deep this corruption goes, and why the governor is now facing potential criminal consequences. Let me walk you through exactly what triggered federal involvement. The investigation began when federal auditors conducting routine oversight noticed something alarming in New York's numbers. The program's costs were increasing at rates that didn't match demographic trends or healthcare inflation. New York's Medicaid spending was growing 5 times faster than comparable states, and nobody could explain why. Federal investigators started digging deeper. They requested enrollment data from New York State and began cross-referencing it against federal databases, Social Security records, IRS tax filings, immigration status, death certificates, and benefit programs in other states. First major finding: enrollment versus eligibility. Federal auditors documented that 8.5 million individuals are currently enrolled in New York's Medicaid program. But when they verified income levels against the program's own eligibility requirements using IRS data, they found only 5.5 million people who actually qualify. That's 3 million recipients who shouldn't be receiving benefits based on income verification. Federal investigators determined this represents systematic failure to verify eligibility and possibly deliberate negligence by state officials who were responsible for oversight. Second major finding: the out-of-state payment scandal. Federal investigators accessed the Public Assistance Reporting Information System, a federal database that tracks when individuals receive benefits across multiple states. What they discovered was stunning. New York had paid $2.6 billion in Medicaid premiums for individuals who were simultaneously receiving benefits in other states or who had permanently relocated years earlier. Federal agents literally traced these people. They found Medicaid recipients living in retirement communities in Florida who'd moved there 5 years ago but remained on New York's rolls. They documented cases of people who left the country entirely, moving to Mexico, the Philippines, other nations, yet New York kept paying their health insurance premiums month after month. How did this happen when federal systems exist specifically to prevent this? That's what made federal investigators suspicious of deliberate negligence. New York had access to the verification database for years, but chose not to use it properly. Third major finding: the home care program explosion. This is where federal investigators believe the most serious criminal fraud occurred. New York operates what's called the Consumer-Directed Personal Assistance Program. Federal auditors documented that this program's spending exploded from $2.5 billion in 2019 to $12 billion in 2025. That's a 480% increase in 6 years. Federal healthcare fraud investigators know that legitimate programs don't grow that fast. That growth rate indicates systematic fraud. Federal prosecutors have now filed criminal charges in multiple cases documenting the fraud schemes. Caregivers billing 23 hours daily, every single day, for family members who didn't need care, earning over $200,000 annually from Medicaid. Between 2021 and 2023, New York paid $14.5 billion for home care services, without proper electronic verification that care was actually provided. Federal auditors found New York's compliance rate was 11% for home health care and 56% for personal care. The state paid billions without verifying anyone actually received services. Now let me walk you through the actual criminal cases federal prosecutors are pursuing. February 2026 marked a major escalation in the federal investigation. Federal prosecutors in the Eastern District of New York announced criminal charges against two Queens residents accused of orchestrating a $120 million fraud scheme. The defendants owned multiple adult daycare centers and a pharmacy. Federal investigators documented their operation. For 10 years, they paid elderly patients cash and grocery gift cards to enroll in their programs. Then they submitted bills to Medicaid for medical treatments that never occurred, prescription medications never dispensed, and daycare services patients never received. What made federal investigators particularly concerned, this fraud operated for 10 years before FBI agents caught them. State oversight completely failed to detect the scheme, despite processing billions in claims from these facilities. This wasn't the only adult daycare prosecution. In 2025, federal prosecutors secured a guilty plea from a Brooklyn operator who admitted running a $68 million fraud using the identical scheme. Fake services, fake patients, real federal money flowing into criminal accounts. Transportation fraud represented another major federal prosecution area. November 2025. Federal prosecutors charged a couple from Orange County with stealing $3.5 million through transportation fraud. Federal investigators documented through GPS data, billing records, and patient interviews that the defendants billed for trips that never occurred. But these private fraud prosecutions, as serious as they are, pale compared to what federal investigators discovered about the state government itself. Whistleblowers came forward to Congress with allegations that seemed almost unbelievable. New York State has been running what amounts to a money laundering operation with federal Medicaid hospital funding for over 20 years. Here's how the alleged scheme works, according to whistleblower testimony and federal investigators. The federal government provides Medicaid dollars to states, specifically designated for safety net hospitals. These federal funds are supposed to go directly to the hospitals to help them stay operational. But whistleblowers testified that New York State receives these federal dollars designated for hospitals, then allegedly forces the hospitals to return the money to the state government. Federal investigators are examining evidence that one hospital, Nassau University Medical Center, was allegedly forced to give back over $1 billion that federal authorities had designated for the hospital's operations. If these allegations prove true, this represents federal fund theft by a state government. Federal money sent for one specific purpose, supporting safety net hospitals, allegedly redirected by state officials for general budget purposes. Congress launched a formal investigation in July 2025. The House Oversight Committee issued subpoenas demanding documents from Governor Hochul's office. Federal prosecutors are examining whether this scheme constitutes wire fraud, theft of federal funds, and conspiracy. If criminal charges result, this wouldn't be prosecution of random scammers. It would be federal criminal charges against state government officials for systematically stealing federal healthcare money. So here's what I need from you. Drop a comment below and tell me if you think federal investigators will actually charge state officials with crimes, or if this is just another case of government protecting government. Have you witnessed Medicaid fraud in your community? If this federal investigation exposure opened your eyes to how deep government corruption really goes, hit that like button and share this video with everyone you know. Americans deserve to understand that federal law enforcement is uncovering massive fraud in government programs, and that your tax dollars are being stolen on a scale that's almost impossible to believe. Make sure you're subscribed to Caitlin Moore and hit that notification bell, because I'm going to continue following this federal investigation as it develops. When federal prosecutors file new charges, when congressional committees issue findings, when federal authorities take action against state officials, I'll be covering every development. This is investigative journalism focused on what federal investigators are actually discovering. not just political spin or government press releases. This is accountability journalism that follows federal law enforcement investigations to show you where your money is really going and who's stealing it. This is Caitlin Moore. Thank you for watching. Remember that federal investigators are finally exposing government fraud that state officials tried to hide for decades. Stay informed, demand accountability from both state and federal officials, and I'll see you in the next investigation.